The World Health Organization says nearly 300 million people around the world suffer from depression. There are many treatments, but in some cases, the therapies don't work. And treatment-resistant depression can become truly debilitating. Nearly 8 million Americans are thought to have it. According to the FDA, a treatment-resistant depression causes an increased risk for suicide, hospitalization, and other serious consequences. But there's good news. The FDA recently approved a new form of an old drug to treat this resistant and devastating condition. Here to talk about this is Dr. Cristina Cusin, Director of the Ketamine Clinic for Depression at Massachusetts General Hospital and Assistant Professor of Psychiatry at Harvard Medical School.
Ketamine is an old anesthetic that has been used in the emergency room, has been used in the operatory room, in theater, in war zones for decades. And just recently, since early 2000s, has been discovered by chance that it has some effect on patients with depression, where the effect is rapid, is within hours, and it can last for weeks. So we've been doing research in depression since 2010. We've been conducting multiple clinical trials to assess the safety, the short-term efficacy, and this led us to decide to open a ketamine clinic to provide treatment to the patients who would not qualify for clinical trials, who had some benefit from clinical trial, and they relapsed, in order to provide ongoing treatment to patients who have failed multiple medications, who have failed almost all the other available options for depression. And if it's still the only thing that works, we continue to help them and provide this treatment.
That's very good. And how does this treatment work? And can you tell us what you have seen in some of your patients with this treatment?
It doesn't work for everybody. It's just a drug, and it works even in patients who have failed electroconvulsive therapy, who is considered the gold standard. And for patients who have failed ECT, there is not a lot of options. So seeing that this drug can work even in patients who are extremely treatment resistant was very encouraging and completely novel. It shifted the paradigm of treatment in our field. In some patients, it alleviates the pain that comes from depression, the emotional pain. And in many patients, we see it alleviates the thoughts of suicide, where the patients within hours tell, I don't know what happened, I just don't want to kill myself anymore, but nothing has changed in my life. I just don't feel so desperate that I need to kill myself.
Have you seen any side effects from using this treatment, this drug?
The side effects usually are limited to the duration of the infusion. So the infusion is very slow, and it's a low dose. They can feel dissociated, they can feel weird or drunk. The blood pressure can increase a little for a period of time. They feel dizzy, they cannot work or operate machinery or drive for a few hours after the infusion, or they may have strange dreams. In under control setting, in those circumstances, the side effects are relatively limited. Nausea is also very common, but they're subsiding within an hour from the end of the infusion, and we haven't really seen other side effects. We're carefully monitoring our patients because the time so far is limited. We have maybe a time horizon of 5 years. We don't know if for prolonged use of ketamine, even in control setting, there may be some rare side effects that we haven't discovered yet.
How does it work to help patients beat this depression? And how long do they need to stay on treatment?
So regarding the mechanism of action, we know it's different from everything else we have. We know it's rapid. While most antidepressants take 4 to 6 weeks to show an effect, ketamine can work in hours, and the peak of the effect is 24 hours later. We know it works for patients who have failed all the other antidepressants, so the mechanism is different. And we have some theories about the action on glutamate and other neurotransmitters, but they still need to be validated in humans. Those models come from animals, so we need to test and to demonstrate those effects in humans still. Regarding the duration of treatment, it depends if we're able to find some other alternative to ketamine, some other treatment or antidepressant that works, then the patient can stop the ketamine. Otherwise, the duration of the effect, like for any drug, is time limited. On average, it's between 3 and 4 weeks for a treatment. So the patients need to continue to come for maintenance treatment. And if ketamine is really the only thing that has ever worked for that patient, the patient needs to come and continue to come for the foreseeable future. We don't have a good alternative.
Okay. Just like anything good when it comes to treatment or medicine or anything, there's also this kind of a off-brand people or institutions that come up offering miracle cures. Can you talk to us about some of the unregulated clinics that have been talking about offering this miracle cure, and what can we do to stop that?
I'm not sure what to do to stop them. We have a very open discussion about what the response rate is in the literature, what the response rate is in our clinic, what are the risks, the benefit, the potential benefit, and all the unknowns of ketamine. So it's a long discussion about the informed consent, and the patient has to be aware of alternatives and the risks and benefits of ketamine, and still it's the patient's decision, together with his or her treatment team, whether to proceed with ketamine. We ask the patient to have a treatment team to work with us and figure out the ketamine, the therapy plan, and how to proceed from there. We don't believe it's a good treatment for everybody. Some of the patients who come for consultation are not appropriate for ketamine, and we have to tell them so. And then we have to work with the patients, even if ketamine does not work for them, and trying to figure out what else can we offer. Because for some patients, it's just not a good option. Either it's not tolerated or just plainly doesn't work.
Well, that goes into the segue for my next question. Is I know researchers are looking at other controlled substances like the ingredient in magic mushrooms and an old drug called MDMA. Why is that?
Yes. Because we believe that some mechanisms can offer a window into the brain and into the mechanisms that cause depression. So if we can unravel the mysteries of what those drugs do to the brain, we may be able to figure out some way to develop newer, better antidepressants with less side effects and harness those mechanisms, understand more about the pathophysiology of depression and what causes major depressive disorder, what causes bipolar disorder. So they may be used as a chemical probe to try to understand those illnesses better, and therefore lead to new type of treatments, completely different from what we have.
Okay, interesting. Doctor, what should our viewers do if they're interested in finding out or finding a regulated clinic like the one you have up in the Northeast? If they're, let's say they're in California or in Florida, where do you suggest they go to find a clinic like yours?
I think they have to do their homework. They have to seek out. There are many academic centers that are offering ketamine treatments, and they're usually affiliated with a team of psychiatrists and psychologists, and they have expertise and they can administer it safely. They have to talk to the psychiatrist and make sure that there are procedures in place to treat side effects, to have some monitoring, and also to have a plan in place because if ketamine works, then the real work needs to start in terms of therapy and rebuilding a life. And if ketamine does not work, you still have to figure out how to proceed from there. So having an open discussion with the ketamine provider about what are the strategies, what are their expectations, and how they're going to proceed in both cases. No less than what you will doing if you are going to talk to an oncologist or a surgeon. You have to know what your options are, you have to do your research, and you have to have a discussion so your consent is truly informed by the data and what the science tells you.
Beautiful. Doctors, thank you so much for being on The Smart Life. We know your time is very valuable. Thank you for great information.
Thank you.